This is Ashley Bunkelman and Katie Cutler with Peeling Back the Truth, episode 24. Sorry that we kept everyone hanging for the last couple months. As you all know, Katie and I are busy, hence Katie is off camera right now, driving home from an appointment. So this is just the way we roll.
And we apologize, but at least we're getting it done. And at the end,
Katie, I lost you. As she's driving, we lost her. So I'm going to continue until Katie jumps back on because we lost her while she's driving home.
oh,
Hi, I can hear you now.
okay. Anyway, I was saying it's only 30, 40 minutes. We need to really be more diligent and make the time.
We do. And with that, we do need to bring up the subject that we always talk about our kids. But my husband, Brandon, was recently listening with my brother making fun of us on our podcast. And then
You don't talk about him.
told me, what people just think you have all these kids and you're not married. Like, you never talk about your husbands. Why don't we ever talk about our husbands? And I'm like, okay, I'll make
Because,
sure at our
first
next
of all,
episode, just so everybody knows.
yeah,
both
I
have
love
two-
my husband. I'll put it. I love you.
Right.
Okay.
I
But,
love my husband. We have two amazing husbands.
men are
Katie has
babies.
4 children and a lot of animals. I have 3 children and a lot of animals, but we love our husbands. Thank you. So this is a shout out to them because they don't
Yeah.
think we ever talk about them.
Woo woo. They're just babies. It's kind of like when you treat a man in your practice
And everything.
and
hurts.
they're like, "Oh my God, this hurts," and you're just like, "Really?" Because I just had someone else in here that said they
Fell
felt
asleep.
nothing.
They weren't saying anything because they fell asleep.
One time I gave Mike a literal calming mask,
I
and
remember
he
he
told
said it
me
burned.
it's burning so bad he can't take it.
Well, I will tell you that the other day I did a Neo on Brandon. He's like, that felt great. So that made me feel really good that because he's a baby, let's be honest. When he has
Yeah.
hand cold.
Well, Mike, every time he gets a cut, he's like, "Can you laser this cut? Because I've never seen anything as amazing." He had a cut on his head and
yeah.
it healed so fast when I lasered it. He could not believe it.
Did you put boo-boo cream over the top too?
Yeah, he couldn't believe it. And it
Right.
literally did. It was like the next day, it was almost healed, where it would have took so
Weeks.
much longer.
Weeks. Absolutely.
Okay.
There you
Here I
are.
am. I'm sitting outside.
Looks like a nice day there. It's raining here. So
Oh yeah, it is kind of sunny here.
So let's get right to it, Katie, because I think it's important to talk about how we're not going to get political about this, everybody, but like our industry right now is on a little lull. And I think, in my professional opinion, and a lot of others I talk to, and Katie, I think you agree, the reason why I think is because there's so many aesthetic practices opening, and it's all in the end, you get what you pay for. Let's use the example of the other day at work at Skin Boss. Somebody was like, "Oh, you guys are really expensive for your Botox. I can get my Botox like $9 or $8.50 a unit." What I have to say to those
But who's doing it?
Right. What I have to say to those people is education, who is doing it, and what's the longevity of that practice? Because I can guarantee if they are a credible practice that's offering it that low, they will not be in business long because they will not be able to pay their bills on that.
Absolutely not. And honestly, Botox is serious. Like, you're injecting somebody, and how about if they inject it wrong? And
You can't reverse
you can't fix
neuromodulators.
it.
You can
And
filler, but not
I've
neuromodulators.
seen Botox issues. I've seen it many, many times. And when I get Botox, I don't care if it's 15 units, whatever. I want it to be
The
right
best.
more than I want to save the money. So if you're going to do it to save, then just don't do it.
So with that being said, I feel like this lull in the industry has a lot to do with people undercutting what they're doing. And as a whole in our industry, undercutting is not helping anybody.
No, and they're
And
also
obviously-
underestimating themselves. If you're a nurse, a medical professional, then you deserve to be paid for your time and your skill properly.
So-
it's not something that is really you want to discount. I mean, I can see running a special here and there, or that's one
Yes.
thing. But just to discount it to that degree, don't underestimate yourself. You are worth it. You're worth it.
And with that, isn't it interesting? And, we have mad respect for everybody that does hair. Obviously, we love our hair, Katie. We have mad respect for salons, hairdressers, but isn't it interesting that they're never undercutting themselves? And you can have a salon on every corner. So, my question is, if they're not doing specials and they're not undercutting themselves, why do we feel it's necessary in the aesthetic arena with tons of education and tons of training? Well, you should have tons of education and training, let's be honest, some don't. But why are we undercutting ourselves in our value, in our
And I
education?
think it's because, especially if you're a new practice, I understand you're just getting started. You want to get patients in, you want to start building, a book of people coming, you want to get regular people. And I get that. But lowering your price, it's not the way to do that. The way to do that is maybe, yes, run a special or um like a grand opening or something, but set the tone from the gate that you are worth it, and that you are a professional, and this is what it costs if you want to take care of your skin and you want to have a provider who is worth it.
I kid you not, this really irked me the other day. And so for anybody listening that's doing this, sorry if this is offensive, but I'm offended by this. I had a consult the other day and the girl in the consult was talking to me and she's like, "Well, the practice that I went to before knew I was coming for my consult, but was asking me like what your pricing was because she'll guarantee she can do it lower." That
Like,
to me, again, I respect car salesmen. I do. I need a car, you need a car, but like that to me was super salesy. Our profession isn't salesy.
and that's another point you're hitting, Ashley. This industry, there's a lot of faces in this world.
Yeah,
We don't have to be in competition. We really don't. If you're
absolutely
good
not.
at what you
Community is
do,
great. Competition, don't compete, have community. Like it's a
have community.
problem.
Because if you're good at what you do, it doesn't matter if someone down the road has the same thing or the same device or the same whatever. If you're good, there's enough people that you can both be busy.
And I am a person that believes in karma. Cheer that person on down the road because you're gonna build
Yes,
relations and what you do is not going to always be the same. There's no clean cut dry way to do anything. Everybody's going to do it the exact same. It's not going to happen. Pride yourself on what you're doing and your highly sought after education, and realistically, I feel that like when you put good in the universe, you get good back.
you get it
And
back. And
and I've talked to
it's so true.
so many practitioners recently with travel. Hence, that's why Katie and I haven't been on in a long time because I feel like we're never home and we're traveling. I've just talked to so many in the industry, and what I'm hearing time after time is they don't want devices with consumables. They don't want a huge markup to where these products that are super, super expensive to keep in their shelves is costing them money. They don't want to have those huge bills, which for me, every time that we are on the road training, obviously everybody knows Katie works directly with Aerolase. I train for Aerolase. So of course we're biased and we're like, well, you don't want consumables. You have Aerolase. You don't want high cost. Well, you don't have to pay for high cost products. Do your research and see white paper studies on great medical grade products that could be middle of the road. So you don't have such a high investment on stocking your shelves. I just think
Exactly.
people get stuck in that wow factor with that shiny bow. This is going to be amazing. I love this. I
I
love that.
mean, and how many times have we talked about this? Like, it is a constant thing in this industry. It's like popularity on TikTok, on Instagram, on wherever, Facebook. It honestly means nothing. It means nothing. You have to. Yes, do you get recognition or get exposure from that? Yes. But you still have to do your own due diligence. And it's a fact. You get what you pay for to a degree.
Absolutely.
You do. You're not getting a Bentley for the same price you're getting a Ford Focus. You're
It's too
just
good to be
not.
true. It's too
They're
good to be true.
they're both cars, but it's just not going to happen. So it's like I hear a lot of people say sometimes, like, when that maybe they're looking at Aralace to purchase and they're like, but I could get this for this much money.
And it's
And
forty
I have
thousand
to
dollars
go,
cheaper.
yeah, it's
But then
40,000.
they have a consumable of 85 every time they use it.
And the device
Yeah.
does this. It does
Does
one or
4
two
things,
things,
not 36, 4 things.
not 36, and it can't treat darker skin or tan skin. So it's closed down most, half the year. So with Aralace, you are using it day in, day out, all day, every day on anybody who comes in your front door. Like, it's kind of a no-brainer. And the efficacy is there. We know
And with
this.
that, like, I just wanna, sorry, Katie, I don't wanna interrupt, but let's just talk about, we have a practitioner, everyone, in Hawaii right now that is killing it with these devices in Hawaii all day,
Goddess
every day.
Aesthetics. Yes, she
Yeah,
is. In
Kanani,
Hawaii, in the pure
amazing.
sun.
In pure sun, all day long, 300 and probably 64 days a year. Killing it in aesthetics right now with these devices
And the
because
results that she's getting
are
are
amazing.
phenomenal. I met Kanani about 2 years ago, I guess, maybe a little longer. And, she was new to lasers, not aesthetics. And watching her just go
Evolve and
from
grow.
that day we started to where she is now and the results that she gets. And like, yeah, did she have concerns in the beginning? Well, I'm in Hawaii, it's so sunny. Well, that's what Aralace is here. You're choosing the perfect device
Yeah.
because and you know what I love about her actually? Not only she doesn't just do skin rejuvenation, melasma, rosacea. She takes the device and uses it to its fullest potential. She's doing body tightening. She's doing
Eczema,
eczema,
psoriasis.
psoriasis. She's using the device across the board, not just for like facial aesthetics. And I think people get it confused, that's all it's for. But
So with that being said, let's say people are a little slower right now, right, Katie? Let's say like there is a little bit drop in the industry right now. Obviously, there's a lot of uncertainty with a lot of things in the world. But with that being said, you just kind of nailed it. People get stuck in this rut where they're like, I've been using my device and I feel like I'm doing really good with it, but like I need to be making more with it. And oftentimes when I talk to those practitioners, they're like, well, I do it for melasma and acne and rejuvenation. I'm like, why aren't you doing vessels? Why aren't you doing onychomycosis? Why aren't you doing more hair removal? Why aren't you doing warts? Why aren't you doing skin tags? These, because I
me,
feel like people are so used to devices that do 4 things
they
that they get
absolutely
lost
are.
in translation of, hey, I could do all of these things. But
So
because
here we go. You're going to
people,
pay, say, $75,000 for something that does a few things. And then, you pay what you're going to pay for Aralace. Although, okay, maybe it's a little more money, but it's worth every single penny because your ROI is endless.
yeah,
Endless. There's not
and
a
you can do it with
patient
everything in your practice. You can do it in combination with everything in your practice. I think that's what people are
everything.
going with the most. So funny, I had a training in the facial division the other day with the girls, and one of the reps came in and she had her platysmal bands filled with filler. And I just said to her, hey, like you have a huge bruise here. What's that from? Because I was just curious. And she came in with an advanced clinical trainer for this facial device that we were working with. And she's like, oh, yeah, it's like 4 days old. I've been putting makeup on it. My daughter thinks it looks like a hickey. I was like, I don't think that looks like a hickey. It looks like a bruise, but that's fine. And I was like, just get over here for a second. Like, let me, I'll call you down. Let me do this. She's like, what are you going to do? And I'm like, we're going to do bruise removal with the Neo. And she's like, what? You can do that? And I was like, absolutely. Took 2 seconds after I wiped her down with alcohol, let it dry, took a picture before and after. Amazing. I'm like, I just want you to know that this is going to heal 10 times quicker. And she already could see all the coagulation coming out of her neck. And it had been like that for 4 days.
And bruises, I mean, a bruise from an injectable can hang around for 2.5
Forever.
weeks.
Yeah.
It really can.
Because you have
Where
to
if
go from the
you,
purpling and the blue to then the yellow, and it's a whole long
it's
process.
and honestly, it's one of those things you cannot cover with cover up, no matter what. It just doesn't cover. It always shines through. Where if you use the Neo on it, we're talking days, and the bruise will heal.
And like Not to go back, I mean, I know we always flip around everybody,
It's
but
okay. Who cares?
we make it fresh.
Yeah,
But to kind of go back to that, like about you get what you pay for. I truly feel the reason why there's a lull in the industry right now is because people are undercutting what they're doing and they think I feel like it's a short-term solution for longevity, which there won't be any longevity because that short-term solution isn't going to work for a long solution seeing it through. To me, that's not smart business ownership. That's not a smart way to run your business. Hold yourself to the highest accountability of integrity and what
definitely.
you've been dealing with education. A nurse, it takes a long time to be a nurse practitioner, PA. And yes, the traditional licensed medical esthetician, yep, you can get done with school in 6 to 12 months. But if you want to be a really good one, doing your internships places, getting that experience, training with these cutting edge providers with lasers or chemical peels or devices, yeah, that makes you good. Having that experience makes you good. But if you're just like, hey, I've never been in the aesthetic arena before and I want to open up a business because it's cash and carry, and we're going to undercut over here on this corner because I know on the other corner they're charging $7 more a unit, you're not going to be open for long and you're actually hurting the entire industry by doing so.
You are. And let's talk about it. You're going to, you don't have the experience. So do you
You're going to hurt
really?
someone.
Yeah, you need, you just said about aesthetic school. So like honestly, going to aesthetic school is like the first baby step
Yeah, it's a baby
in
step,
your
everybody. Baby.
education if you're going to be in medical aesthetics. It is a baby step into. It is not the only thing that needs to be done. First of all, the word laser or microneedle or they're not even spoken of.
Chemical peel isn't even done in
Yeah.
aesthetic school.
So that is
Or
step
Katie, we're
like
not
to
even doing
really get to know
extractions
skin.
anymore.
No. So it is a matter of that is the beginning. Then there has to be an internship with a qualified medical aesthetic professional, a laser biophysics school. So you really understand what are lasers? What do they do? Why do they work? How do they, you know, then you have to work with something and shadow someone in a practice. Like if you are a responsible provider, you're doing these things. Why I don't even understand why we think that we can just flip from one career to another and think we're going to be super like advanced.
So
It just
interesting you
doesn't
say
work
that
like
because
that.
I have a friend that has been an MA for years. She took some time off, has kids, they're in high school. She's like, I'm kind of like ready to refresh myself. And she took like 7 years off at MA when she was raising her kids. And for everybody that doesn't know that, MA medical assistant. She's like, I think I'm gonna go back to aesthetic school and I want to jump right into this spa in the aesthetic industry and do that. And I'm like, she's like, what do you think? And I was like, well, because you're asking me what I
Oh,
think, I'm going to be really honest with you. I think it's a bad idea because she's like, oh, it's only going to take me 6 months if I do full time. I'm like, well, yes, I think it's a bad idea if you think you're going to jump right in and make buco bucks at an aesthetic arena after 6 months of having your license because I've been doing this almost 20 years. You've been doing this almost the same amount of time, Katie. We didn't jump right into it. We did what we were supposed to the right way to get qualified. And people just think, oh, this is a great idea. 6 months, I'm just going to make all this money. And it's good luck because it's not going to be that. It's going to be a lot of after hours working after 5. It's going to be a lot of on the weekends. And you're going to have to
learning
do
from qualified professionals.
right. And you're going to have to do your homework on the side to understand and really get aesthetics since it changes every single day.
Every day. I mean,
So I told her, I was
every
like, if
day.
you're looking for an easy way out and you think you're going to make really great money, doing that is not the answer.
It's not. It's not. I love when people say that to me, like, oh, I want to do what you do. Well, okay, but like, do you think I just applied for a job or like I've worked so long to
Hustle,
get the
hustle.
knowledge that I have and the information that I have in this industry. And I know it so well now, but not because even of school. It's time in clinic, time with a patient on
Experience.
the table, time with a laser in my hand. All those things are what made me, good at what I am at this profession. So it's not something you can just say
Overnight.
It's like I think it's similar, like even in something like nursing. Nurses go to school, but like when do you get the real experience in the hospital treating
Yep.
patients? That's
Yep.
when you really get in.
And
I was a teacher in school. I didn't learn how to teach in the classroom. I learned how to teach when I student taught the first time. And then my first couple of years as a teacher, that's when I
that's how you
really
blossom
learned.
through. Right.
Yes.
And I tell Isabella that all the time for people out there that don't know, yes, we love our husbands, but my oldest name's Isabella. She's going to nursing school. And I told her when she started going to school to be a nurse, obviously she's doing her prereqs right now. She's not in nursing school right now. I said, she always says she wants to be just like our lead injector at Skin Boss. I want to be like Mimi. I want to inject like Mimi because shout out, Mimi's amazing, everybody. We've been working alongside each other for 16 years and she's one of the best injectors in the entire country. And I'll say that. But I always say, that's great, honey, but you need experience first as a nurse. Like you need to work in the ER for a couple years. I mean, Mimi, our nurse injector, she worked in baby and delivery for 26 years when she wanted to switch careers. And 16 years ago, when she did that, she hustled, worked her butt off, continued to work as a baby and delivery nurse on the weekends while she got her feet wet injecting and going to all these classes internationally and nationally.
Yeah.
And so I tell
Or
Bella all
maybe
the
even it
time,
means that she does nursing and dermatology for a while,
right, get the
somewhere where she's
experience.
exposed to, skin
And you know what? Could I, when she's at that point, Katie, could I set her up really cushy and be like, yeah, you can learn from her and we'll bring you in? We could. But do I think that's going to help her? No, she
no.
needs real live clinical experience. I think she needs to do ER. I think she probably needs to do plastics. I think she probably needs to do dermatology and then come back full circle because she needs the experience.
You
Just like you
do.
and I, with our foot in the door, like you said, you did front desk work at first. I started doing that too. And then we ended up where we were, where you were at the school and where I was doing internship at the derm. And like,
Yes.
it's a long road.
My journey is long,
It's long. And I
very
love when
long.
people are, 55 and they're ready to switch careers. I'm like, okay, well, you're going to be doing that when you're 80 because, you know,
Yeah, my journey is
and by
long
the
and
way, let's talk about
education
that.
is
The new 80
endless.
is like the new 50 because people look amazing from aesthetics that you can't even tell. But with that, I really want to stress, Katie, to people that like our industry is at a lull because you're undercutting your value of the aesthetic arena as a whole when you're undercutting prices and you're not working with community, you're working with competition, and therefore it is going to decrease and dissolve the industry
As a
unless
whole.
you're a huge practice that has multiple facilities that has 3 doctors with you working side by side and has those huge, elite premium programs with the injectables and neuromodulators. Like you're basically gonna crap on the little men that are trying to make a living that
Yeah.
are
And,
quality.
and like that's the thing. What about the practices that's a one-man show, and they're doing amazing, but like it's going to end up hurting them in the long run. So like we need to work as a team
Right.
and like know that the value is real.
What do we
It
always
is
say, Katie?
real.
Know your worth. Know your worth.
Know your worth. Do not underestimate
So
yourself.
I think that if you're a
And
practitioner that's listening to this right now, and let's say you might be really trying to get your name out there and you're doing not necessarily specials, because I believe in specials. We do specials a lot.
I believe in specials.
But
Yes.
if you're physically undermining the place up the street and telling people, bring me the price, I'll do better for you, or undercutting your education, you're not helping anyone, including yourself. You're not helping yourself. You're not helping the community around you. And with that being said, good luck staying in business the next 5 years.
Yep. It's absolutely true. And you're not going to have sustainability where your clients are coming back, because if you're charging cheap and your result isn't great, they're not coming back. They're going to the place down the street that's charging the right price because
It's
they
so
know
funny.
they're going to get what they pay for.
Exactly. And like I heard a story the other day, this girl's like, oh my gosh, I got Botox somewhere else, blah, 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 blah. But I walked in, she's like, oh, hi, nice to meet you. And all of a sudden just starts poking. Doesn't take any photos, doesn't ask what's bothering her. And then she was done. But she only paid $750 a unit for Botox. And she's like, it lasted 5 months, but one of my brows was all messed up. And I'm like, well, the average dilution on a patient, unless you run through, work out a lot and all of that, like is three months maybe. But then when she's like 750 unit, I'm like, yeah, that probably wasn't diluted correctly, or that practitioner really messed up and literally just gave it to you for free and probably
Yeah.
won't be in business long. And
No,
guess what? But here's the thing, Katie, she came to us. That's
of
how we
course.
met her a couple
So
months
they
that's how we
end
met her a couple
up,
weeks ago.
even if you,
She didn't even go back.
so keep yourself high standard because they will come. They will come because they're going to go to those other places and learn it's not worth it in this area to save $1.
So
And
our
it's the
practitioners
same.
were like, I'm gonna take pictures first. And she's like, oh, she's like, well, she took pictures of you last time, right? She's like, no. Like, but
It's
that's
not worth
insane.
saving $1. Like, and the same with devices. Like the Neo can bring in so much ROI, right? So much because it's
So
nonstop. So
consumable.
even if you're looking at something else that's saving you money, what is the point if you can't use it on half of your clients? It absolutely makes no sense.
Or in the
None.
summer.
Or in the summer. So it's just like it's kind of a no-brainer. I almost really one time, I'll never forget, I was at a show and this girl told me she might buy this device. And I literally got tears in my eyes because the girl was so sweet. And I was like, don't do it, because I knew if she got
It was
Airly's
gonna screw up
Neo.
her business if she got that device.
Exactly. Exactly. I
And
just want to say really quick before we end this. Okay, so my dog scratched me. I don't have sunburn on the tip of my nose.
I
Just
can't even see.
FYI, it's like beet red. I look like Rudolph.
I literally can't see it at all. I mean, I have
He
no makeup
scratched
on
me.
and look grungy. So there's that, everybody. Welcome to
He
my life
scratched
and
me with
Katie's life.
his tooth.
Aw, I love your puppies.
Yeah.
I
But
just, let's throw out some myths and truths really quick,
let's
Katie,
do it.
at the end.
Let's do it.
So I feel that it's a myth if you have the best prices in town that you're going to be successful.
That is an absolute myth. Truth is, you get what you pay for.
100%. And the truth is, if you put good out in the universe, I truly believe you get it back.
And a myth is just go anywhere. Don't research anything. Just if someone says they do Botox, they're definitely good at it. Or if they do lasers, they totally know what they're doing. Don't look into it. Don't research it. Just walk in anywhere.
And anybody listening to
That's
this
a
right now,
definite myth.
I really hope we're getting to you with hold your worth, hold your head high. We're going to get through this lull in the industry and make sure that you are not undercutting your professional standpoint and your education that you have in this industry because we are worth it. And I really feel that this is just a little bump in the road. And if you're somebody that's undercutting, rethink your business model because you're not going to
Rethink
have longevity.
yourself. Love yourself, love yourself and like play out the tape. Don't just live in like the minute
The
in the moment.
moment,
Play it out
longevity.
the long term. Yeah, exactly. Play it out. Like, if I do this now, what about later? And like, look at it like, okay, you might save money in a minute buying a less expensive product, but down the road, when you have something sitting in a corner not being used, what was the point of the money saved? Nothing.
Collecting dust and collecting more payment to fulfill later. So,
100%. So
well,
think about it, research. Don't go on everybody else's word. Find out for yourself. There are so many resources out there to research. Do it. I mean, like,
and
I don't,
also, I love a Groupon. Don't get your aesthetics on Groupon.
yeah, Groupons are for like, a maze room that you go with your kids. You could use a
Yes,
Groupon for that.
an escape room,
Or a
is what Katie's saying.
bouncy an escape room or a bouncy house. Yeah, not for Botox or a laser treatment.
Or like putt-putt golf.
Yeah. And
Something
did you
like
know
that.
this, Ashley? It's the end of laser season. So they
Well,
say. but
I love
not
that it's the end of
for
laser
us.
season right now for everybody else, but for our clinic at Skin Boss, that's like the longevity of starting our laser season again.
Exactly,
So
because our
we,
there is no end of laser season.
yeah, nothing with laser
It's an
season
all
has been
year
going out.
round laser season.
Absolutely. I love it. Well, we do promise you that we're going to be on here more, everybody. And I think Katie and I are vowing like every couple weeks we'll do one. So we won't go
We
as
will.
long.
We really are gonna be
We
better.
love everybody that listens and we hope that we're making a little bit of an impact in your life. So we will see you soon. Again, it's Katie Cutler and Ashley Bunkelman with Peeling Back the Truth.